Hello and welcome to another quick 5 to 10 minute blog summary video for the Cancer Physio. Today's topic is an exciting one. When most people think of cancer and rehabilitation or services, lymphedema is a huge community, big word that kind of comes to mind for a lot of people. There's a lot of movement and a lot of trend behind it and a lot of importance as well. So today we're kind of spinning the conversation a little bit and talking a little bit about the role that exercise has in lymphedema and just updating a little bit of what we would consider kind of gold standard or evidence-based strategies. So in today's blog, we really emphasize that early recognition plus proactive care can equal management and prevention. So what we mean by that is if you detect it early, you have some tools and tips to be prepared before any onset, that can equal, preventing lymphedema from occurring in the first place or managing it really effectively. So what is cancer-related lymphedema? Well, it's a long-term swelling condition caused by damage to the lymphatic system. And everywhere in your body, you have kind of different bundles of these lymph nodes. As an example, kind of in the armpit chest area, people have anywhere from 20 to 40, so big variation for individuals. And imagine if you have some surgeries or some radiation treatment. Maybe those surgeries were biopsies or removal of lymph nodes. And so what happens is that some of the drainage sites become impaired. So you can imagine that all of a sudden you have 75% drainage capacity instead of 100% drainage capacity. So you can think of it kind of like a drainage condition, okay? Common symptoms include swelling or puffiness of the affected area or the limb associated with the area of treatment, feelings of heaviness or tightness, reduced flexibility, aching or discomfort, even changes in skin thickness or texture. What's interesting about lymphedema is that you can actually have it without actually seeing any swelling, and I don't think a lot of patients are aware of that. So if you have a limb that feels heavy or full or painful for long periods of time, even if we don't visibly see any difference in swelling in the hands or the arms, that could still be considered stage 0 lymphedema, unfortunately. And stage 1 is when we start to see a little bit of swelling. Of course, there's a scale here that goes from 0 to 3 with progressing symptoms. Stage 3 would be when it's quite severe and we actually see long-term changes in skin health. You can imagine that the drainage isn't happening effectively, so the skin actually starts becoming a little bit impaired with its ability to heal and regenerate, and it can get thick and so on. So we definitely want to try to avoid stage 3, and we can now with evidence-based tools like this and exercise. So we know that early recognition and proactive care are key to preventing progression, and research just consistently shows that lymphedema can be safely and effectively managed with exercise and self-care strategies. So we're going to dive a little bit deeper now into why exercise is a very important tool for lymphedema. And I find this area really exciting. This is my area of passion in the world of lymphedema, because for so long, patients with lymphedema were told to not move very much or told to not exercise too much because it wasn't considered safe. I still have patients that come into my clinic, unfortunately, who say that they were told that they'll never plank again, or they shouldn't do a push-up, or that they can't get their heart rate too high. And I really think it's important to kind of look at broader studies now and the current evidence as to what we're saying, and exercise can be done safely and is effective in managing lymphedema. And so why is that? Well, first and foremost, exercise helps move lymph fluid. Muscles act like little pumps, and so that actually helps with sometimes the congestion and helps move the lymph towards central drainage pathways. I think it's important to understand that even a healthy individual that doesn't have lymphedema, when they exercise, they actually get a bit of swelling. It's called transient edema. This is why fitness competitors do a bunch of push-ups before they go on stage, because they're going to get pump and a bit of swell. So there's a normal amount of swelling that happens with exercise, and I think this is where sometimes the community started thinking that exercise made lymphedema worse. So there were some really great studies 20 years ago or so about dragon boating, breast in a boat. It's a famous study. And this is kind of where we started exploring that whether these patients were pushing hard on a dragon boat or exercising as part of the program, that they didn't experience long-term exacerbations of their lymphedema. So this is where we're starting to really be confident that exercise can help. We also know that it improves flexibility and range of motion. So that can help with any kind of adhesions or stickiness of the lymph vessels that then are congested, and through some stretching and movement can free themselves up. We also know that exercise helps support healthy body weight, and a high body mass index is one of the most strongly correlated factors for lymphedema. So actually your body weight and whether you are overweight predisposes you into a higher risk category for lymphedema. And I'm very honest with my patients about that. When they come in very concerned about lymphedema and they've only had, let's say, 3 or 4 lymph nodes removed, I explain that that might only be a 10% congestion, and because they are moderate to healthy weight, they're at a low risk category. So it's important to look at all factors. We also know that stress is reduced and mood is improved with exercise, which then leads to less fatigue and the ability to move more. And so that has this nice positive loop with reinforcing lymphedema management. So what are the best exercises for managing lymphedema? Well, the first one is super easy and anyone can do it, and that is just deep diaphragmatic breathing. I talk a little bit about this in my breathwork description in my cancer and cold plunging blog, where I describe a little bit about how breathwork can be used to avoid panic and control our states of stress when in a stimulus like cold. But breathwork and specifically diaphragmatic breathing in this case actually helps to stimulate the thoracic duct, lower stress hormones, which in turn helps with lymph fluid and congestion. So that's an easy one that can be done anytime, anywhere. Gentle range of motion, so we know just kind of shoulder circles. I'll tell my patients to kind of do some fist pumping when they're walking if they're feeling some fullness in their arm, or like kind of calf raises in a seated chair can help with the calf acting like a bit of a pump. All these little movements count. And so if people are on flights or on long car rides, I call these exercise snacks, and I help my patients to find a couple little movements that can help keep the lymph moving. Strength training is an additional tool now for lymph management and prevention. And yes, it is safe. So this is very exciting. Research has really confirmed that it's outdated advice to avoid lifting, and instead it's been replaced by strong evidence that progressive resistance training is safe and beneficial for people with lymphedema. But of course you want to go low and slow. So we want to start with light weights, gentle range of motion, explore it with your body, build the range of motion tolerance, and then add progressive weights over time. And if you're interested in any kind of personalized rehab plans on how to start an aerobic training program, get back to running, start strength training with lymphedema, that's definitely something we specialize here at the Cancer Physio. So feel free to reach out via telehealth or in clinic. The last tool, of course, is low impact exercise, aerobic exercise, very effective for lymphedema management. We do want to start with light intensity. And here at this link, I speak to what is light intensity and how to measure it yourself. We also know, very excitingly, compression has been used for a long time in the lymphedema world. It continues to be a very useful tool. And so compression therapy coupled with exercise can be a powerful combination. This is because the compression can help to support lymphatic return and reduce that post-exercise swelling that we all kind of tend to get. It can also improve comfort during movement. So if someone has stage 1, stage 2 lymphedema, I'd recommend that they definitely exercise with compression. For people that are stage 0, it's very personalized and optional, but it's all about kind of trying it and seeing how it feels for you. I have a post of compression garment suppliers and fitters on the resources section of my website. There's a provider network, and then there would be services listed, so feel free to have a look there for anyone in your community who could fit and supply you with these compression garments. There are, of course, the last kind of bit of tools to support with lymphedema care, the self-care area. We've talked about exercise, we've talked about compression. Well, self-care routines are also amazing. Some people like to see a manual lymphatic drainage specialist. These are clinicians that have been trained in this area, and they undergo pretty thorough certification. This can be an RMT, a physio, an OT, and this is a massage technique that you can pay and have someone do anywhere for 30 to 45 to 60 minutes, sometimes up to 90. And that kind of long manual therapy session can help reduce the lymphatic congestion for many people. Symptom tracking is also another great self-care tool. This helps you to understand that if there's any kind of ebb and flow in your lymph, you start to understand that pattern a bit and trust it, as opposed to kind of reacting every time you have a bit of swelling. Hormonal shifts and hormonal cycles, salt intake, diet, stress, sleep deprivation can all kind of change how much our body naturally swells versus absorbs lymph. So symptom tracking and some tracking tools can be helpful. And finally, of course, your biggest lymphatic organ is your skin. So taking care of it, keeping it moist, keeping it healthy is a very powerful tool. In the infected area, if you do have stage 0 or such lymphedema, stage 1, 2, or 3, and you do have a small cut or burn, you do want to tend to that immediately, because sometimes with that impaired drainage, you also are at a bit more increased risk of infection. So you really just want to take care of your skin and take care of any nicks or cuts if they occur. So the general take-home message is that, excitingly, exercise is safe and beneficial for lymphedema management. And once again, if you're interested in a strength or aerobic training program that's personalized to you, that's something we can provide here. In addition to exercise, compression and a self-care routine are also gold standard. So once again, thank you for your interest in science and rehab today.